Yeah. Okay, the recording's gotten started. All right, so let's get started. So go ahead, and we're.
Go ahead.
Right. Thank you. Thanks everyone for joining us. My name is Christiane Staff, and joining us in a little bit will be Sarah J. Sanford with our data and evaluation team. And just so people are aware, we are discussing today's presentation for the Best Starts for Kids initiative is around the Adolescent Immunization Learning Collaborative RFP that's open right now as of August 15th. So, in just a couple of housekeeping pieces. This webinar is being recorded, so if you miss anything, it will be posted online, so don't worry. You can watch it again as many times as you'd like. All questions that are submitted via email will be responded to within 24 hours, posted online if applicable. And just so folks know, information about this RFP is available in a couple of different places. If you go to our King County Public Health website, if you look on the left-hand menu, you go down to the Business Partnerships tab and click on that. You can find out about all of the RFPs that are currently open for King County Public Health. Another great place to check us out is on the Best Starts for Kids blog, and I strongly encourage you, if you haven't subscribed to that already, it's a great place to keep informed about all the awesome, innovative things that are going on with Best Starts. With that, we'll get started here. Just a brief overview of the agenda. So what we'll do today is we'll do a brief overview of Best Starts for Kids in general, and we'll talk a little bit about where this particular initiative fits within that framework. And then we'll discuss some of the core goals and activities of this project, as well as review some of the key specifics within the RFP. Our goal today is really to try to leave as much time open as possible for questions and answers. And hopefully we'll get to most questions, but if not, again, you'll be able to email them in. Questions are going to be noted. They will be taken down, and we'll have a Q&A posted. And toward the end of our presentation here, Sarah J. will be presenting on data and evaluation and how that fits in here. And just a note about how you can ask questions. You can type them into the chat box. It's actually kind of the preferred way if folks have that option, because that way we can be sure to take them down exactly as you ask them. But we can also take them by audio over the telephone. Again, we want to leave the majority of time for questions today. But if by any chance we don't get to yours, no worries. Again, you can email them in to our procurement. They have to be routed through our procurement. And that email address is cpres-bsk@kingcounty.gov. Don't worry about memorizing that right now. It's found on page 1 of the RFP. You can find that email address on page 1 of the RFP. Just keep in mind the final day to ask questions is September 6th, and that is coming up right around the corner. So, what is Best Starts for Kids? For those of you who aren't aware, Best Starts for Kids is a comprehensive investment by King County in our children and youth from prenatal through 24 years old and their families and their communities. It's a voter-approved tax-based levy that's expected to generate around $399 million through 2021. And at its root, at its core, is the fundamental belief that essentially our county is an area that's rich in opportunities, and that basically all King County residents do well when each and every child, youth, and young adult is given every opportunity to thrive and be successful. And what is our vision for this? What's the reason that our goal in doing this, our end game, is essentially we want to see more babies born healthy, more kids thriving, and more young people growing up to be happy, healthy, successful adults. And how are we doing that within Best Starts for Kids? So the overarching strategy of Best Starts for Kids is to improve the health and well-being of King County residents by investing in promotion, prevention, early intervention, and necessary policies and systems change that pertain to youth in their communities. So essentially, we want to increase the good and decrease the bad, and then intervene strategically along the way through that, all along the developmental spectrum up to 24 years old. And while at the same time we want to be sure to address any policy and system changes that need to happen in order to further this objective. So Best Starts is a comprehensive strategy with 4 key focus areas. So investing early before age 5 in order to support healthy starts for kids, and then seeking to sustain those gains by investing in key places along the way up to 24 years old, and then also trying to ensure that kids are able to live in thriving communities, and then using and engaging data and evaluation to figure out what we're doing well and then keep doing more of it. And as you can see from this slide, that you can see that the estimated funding levels for each of these 4 key areas, and the majority of funds, so about 85%, are in those 2 areas of investing early and sustaining the gain. So with regard to this particular funding opportunity, we fall within the strategy area of sustaining the gain, that 5 to 24-year-old age bracket, where we'll be investing in promotion and prevention and early intervention strategies for that group. This particular project aims to meet the health needs of youth by promoting preventive health care with a goal of increasing vaccination coverage rates for adolescents and teens. So it's a very, unlike a lot of the other BSK projects, this is a very, very specific small piece of this overall picture. So what is our approach? I'm going to try to say a lot in a very little time here, and what I would have you do is refer to the RFP specifically, especially to pages 4 and 5, where we talk a little bit more in depth about this in the description. But the objective of this RFP is really to facilitate a partnership between us here in public health and the immunization team and a local contracted community-based organization to bring up a quality improvement learning collaborative. And that collaborative's their primary aim will be to increase adolescent immunization coverage. And how are we going to do that? Well, it will be through running basically 9-month quality improvement cycles with participating healthcare practices, participating members that are recruited to this collaborative. And because our immunization team is deeply involved with surveillance around immunization coverage rates, we are aware that particularly with adolescents, the HPV coverage rates are particularly poor, not just in King County, but in fact in Washington State and across the entire country. So there will be some specific emphasis on that area of adolescent immunizations, just because we know those have particularly poor coverage rates and poor completion rates. But keep in mind that the goal is to look at all recommended adolescent vaccines. So this entails all of them for teens and adolescents. And the goal here is really to create a learning network, right? So all these different participating practices that come to the table, different healthcare settings, any healthcare setting that's delivering primary care to adolescents and teens, in engaging them in interventions and strategies and activities that are aimed at improving care, which will ultimately result in improving immunization coverage. And so it's really about pulling all those folks together in a learning experience, an ongoing learning experience, an opportunity to engage improvement science in order to improve care and work on getting more of our kids vaccinated. And when I talk about members, recruiting members to the collaborative, we're talking about all the different kinds of health settings. So it's private and group practices, pediatric, family practices, but also school-based health centers will be an important partner in this, community health organizations, FQHCs, any of those settings where primary care and preventive care is delivered to adolescents and teens, especially those that are delivering vaccines. And keep in mind, this is a partnership. The idea here is that this will be a combined effort between both us here on the immunization team and whoever our contracted partner is. And if you take a look at those activities that are on page 4 and 5, they're primarily going to be centered on training and support, running through those QI cycles, doing that data analysis and evaluation, providing that feedback, engaging practices in that feedback. But a key piece of this that we're looking for from a partner is that ability to manage maintenance of certification units, points, and for participating physicians. That's our key carrot for getting them to participate. So that's going to be an important piece of this as well. And another thing to keep in mind is that our goal here is a lot of times when people hear the word learning collaborative, they think of a short-term or a time-specific intervention that's done, that's sort of one and done. Our goal here is to create something that's durable. We really want this in kind of an improvement partnership that continues over time. So we are looking for this to last through the life of the levy and beyond, and potentially maybe be able to be scaled up at some point. So with regard to the funding strategy, the average annual investment will be $200,000, and it will be one contract awarded to one agency. We're looking for one partner. And for those of you to be aware that under Best Starts for Kids, contracts can be no longer than 3 years. They can be 3-year maximum. So at some point before that 3-year period, we will issue another RFP, but it will be, the point of that will be to really just to continue this work and continue going. Because again, the idea is that we want to create a durable model that really has the capacity to grow, something sustainable. And again, keep in mind the responsibility will be shared between the two partners. So now we'll go over a little bit of general information, some of the stuff that's sort of the nuts and bolts of the RFP. We'll go over eligibility and submission requirements and just some key things to pay attention to there. So eligibility. And again, I'm going to refer you to the description sections that are in detail on page 4 and 5 to keep in mind. But what we're essentially looking for on the immunization team is a partner that can help us and who's got some experience in facilitating that education and outreach and promotion of initiatives specifically to healthcare providers. And along that way then, someone who's got a strong understanding of the health network here in King County that provides primary and preventive care to adolescents and teens, having that knowledge and those relationships. And again, to be able to manage those MOCs and maintenance of certification requirements for physicians is going to be really important in this. And some knowledge about immunizations recommended for adolescents and teens. So, and if you took a deep dive into those details on pages 4 and 5, the kinds of activities that we're looking for, and again, keeping in mind what we're looking for is someone who will work with us to be able to do all these things. So please, when you're doing an RFP, think about what strengths and abilities that you can bring to this table that will help us work together to do all this. We're not looking for someone who carries all of this load. And so we're talking about facilitating marketing and outreach and really doing that engagement and enrolling, getting participants on board, and having a web-based presence someplace where once members are enrolled, they have a centralized place to go and get information and interact with this collaborative, and helping to sort of create the brand for this collaborative. We're talking about engaging data and analysis of that data in order to really engage it with the practices, help them to grab a hold of it and understand it, and develop some goals and to retool measures and really look for key areas of opportunity within their practices where maybe minor changes could impact their immunization rates. So we're looking for someone who can help us work together in order to make that happen. And again, I would just say, keep in mind the MOCs is an important part of this for us. We also are looking for folks who maybe have, together with us, have a knowledge of some content experts or relationships with content experts or resources for clinical and non-clinical folks who can help do those educational pieces. That'll be part of the quality improvement activities, this education to the physicians around these topic areas. So here's the timeline out of the RFP. This is straight out of the RFP. It was issued on August 15th, so we're live. We've been live for 15 days now. So to keep in mind, a couple of key dates I just wanted people to keep in mind here is that RFP responses are due no later than 2 p.m. on September 27th. Not 2:01, not 2:10, not 2:30, 2 p.m. They need to be emailed to that email address I mentioned earlier. It is on page 1 of the RFP. And also the final day to ask questions is September 6th. And again, that's right around the corner. So you can email those questions in to that same email address. Our goal is that we'll have them rated and the final list published by October 25th. So we're looking for a pretty quick turnaround on this. So submission requirements, just some housekeeping stuff. Please, please, please remember to complete and sign that cover sheet that's found on page 13 of the RFP. And with regard to your narrative response, we're looking for 10 pages maximum. Please read that word, maximum, not minimum, 10 pages maximum. If you can tell us your story and you can adequately cover all the questions that are outlined in the application in 5 pages, great. Take the pages that you need, but please don't go over 10 pages. That's our cutoff point. And then 12-point font, 1-inch margins, pretty standard thing is please number your pages. But remember to address all the questions that are found in that attachment 2 in the RFP that's titled application. You can find that. I believe it's something you can download from this presentation, but it's also on page 14 of the RFP. So rating criteria. This is the rating criteria this is the weighting as it shows in the RFP. And I just wanted to bring to your attention here, all across all of the BSK funding initiatives, just to take a look at that third bullet under budget. The budget is not rated, but keep in mind that up to 10% of the budget is dedicated to needs to be dedicated to evaluation activities. And Sarah J will be talking to you a little bit more about that in just a minute. So a full description of the rating criteria can be found on pages 7 and 8 in more fleshed out detail. But the most competitive applications were going to be those that clearly articulate how applicants meet this criteria found in this section. This slide just sort of distills some of it out. But please also pay attention to why we still are a very specific project. All initiatives out of King County, and especially with BSK, are going to be grounded in equity and social justice, so please make sure you pay attention to that section as well. And now I will turn it over to Sarah J. Sanford with our evaluation team to talk to you about data.
Thank you. So I'm going to share some tips and tricks to help use data to make a compelling and hopefully successful application, and talk briefly about what you can expect around evaluation from this RFP. So our first piece of advice to you when thinking about using data in your application is to start by identifying your story. Firstly, you can spend a lot of time digging through a lot of numbers that you may not ultimately decide to include if you start with the data instead of starting with the story. So if you decide what it is that you want to communicate, then think about what pieces of information will help you to tell that story in a compelling way. And this RFP is a little bit unique compared to some other funding opportunities through Best Starts for Kids because it's pretty specific about what we want to do. So when you think about that story, the most successful application will show not only that you have an understanding of the landscape of adolescent immunization coverage and challenges in King County, but also tell the story of why your organization has the capacity to be really successful bringing together this learning collaborative. So going back to finding the data that you need, be creative. There's some publicly available information about immunization coverage, but you might have data inside your own organization that can help as well. And that can include numbers as well as quotes, stories, or even images. So a few examples might be if you have done QI before and had some great success, what numbers do you have that will show how you have used QI before? Maybe you've done different forms of provider education with healthcare providers in the past, and you have some evidence of how that was meaningful in improving their practice. Or maybe you've brought together similar learning collaboratives, and you have quotes or numbers that show how you've been successful at recruiting and engaging participants in similar learning collaborative groups for healthcare providers. So we really encourage you to think broadly about data and use it to show in your application that you understand the issues with adolescent immunizations and that your organization is well placed to help healthcare providers bring those rates up. Now, switching over a little bit to evaluation, Christy Ann mentioned that we're asking applicants to include up to 10% of the budget for evaluation. And we're not asking for a specific evaluation plan in your application. So if you have ideas that you're really excited about for evaluating a project like this, you certainly are free to include them. But we'll be working collaboratively with the funded applicant to develop that evaluation plan once we start working on the contracting process. It's not something that you need to put together just for the purposes of the application. And the reason that we're asking you to include some resources in the budget for evaluation is to make sure that applicants understand that evaluation will likely take some resources, including staff time and maybe other kinds of resources as well, to evaluate how well our work together on this is going and what can be improved as we move forward together. So that's the basic information about evaluation here, and I'll turn it back over to Christiane. We look forward to hearing your questions.
So before I go into questions a little bit, just to piggyback on that is to keep in mind that then within your budget you need to make sure you allocate 10% toward that evaluation piece, that evaluation plan piece. The expectation is not that you would have an evaluation plan already, but that will be a collaborative effort with us as well. And that someone else has pointed out to me that, the RFP describes that we are looking at a national model for an improvement partnership that we've been examining as sort of to help us shape this vision. So if people are interested in that, you can go to we've been closely watching the model, the only national model really that I've seen out there that's through the University of Vermont Medical School. They have a project called NIPN, N-I-P-N. If you want to take a look at that, that may also help you flesh out a little more understanding of what we've been looking at in terms of a model we'd like to model after. So with that, we'll go ahead and start taking some questions. There's no questions yet. Oh, yeah, so if you have any questions, please type in. Sorry about that. I am not the driver of this technical platform here, so I'm definitely dependent on my producer here. Go ahead and type your questions in the chat box. I'll be able to see them right here on my screen, and we'll be able to address them. Does anyone have any questions or any more information or any more resources people are interested in? Just let us know. The other thing I would say for people to keep in mind is that if you're not an expert in quality improvement and improvement science, you're not an IHI certified QI expert, that's okay. We're not necessarily looking for someone who has to be that expert, but within your application, describe how you're the ideal partner to help work with us to do those kinds of things. You don't necessarily have to be someone who is a QI-oriented agency only. Looks like we have about 20 people with us. So does anyone have any questions? Anyone looking for any more information? Also, in terms of contracting or anything else, we have our contracting folks on with us as well.
Christiane, can you hear me?
Again, we realize that within Best Starts for Kids, this is a very specific, it's a small piece, and it's very different in terms of being our focus, right? The target audience for our intervention here really is healthcare practitioners and not delivering direct services to youth and communities in the same way. So this is we just want to recognize that this is a lot different than the other Best Arts projects. I do not hear them.
This is Hannah. So we've got a couple folks it sounds like you can't hear.
Okay, I'm sorry. I'm just not hearing you. Who's with us?
This is Hannah Johnson.
Hey, Hannah.
And there's a couple folks on the line who have questions, but it sounds like you're not able to hear them through your computer.
Nope.
But I can, so if those folks who do have a question want to go ahead and ask it, I'll relay the question to Christiane.
Great.
Hi, can you hear me there?
Yes, I can hear you.
Hi, this is Ahmed with Somali Health Board. I wanted to get a clarification in regards to this RFP. Did I hear correctly? This is just for providers and hospitals or clinics. Can community-based organizations such as Smart Health Board that does a lot of outreach on immunizations, even along with public health, can we apply for this RFP? And if so, does that require for us to partner with a clinic?
So, sure, that's a great question. Thank you. So absolutely, community-based organizations can apply as well. The partner we're looking for here is someone who can work with us on helping to basically execute these QI strategies, pull this learning network together, but the target for our intervention here, who we're going to be working with, will be healthcare practices and healthcare practitioners. So the Learning Collaborative membership will be made up ideally of any healthcare setting, any healthcare practice or practitioner who's delivering preventive and primary care services to youth and adolescents. So we're looking for folks to work with us, with clinicians, and to execute healthcare quality improvement initiatives, basically. Did that answer your question?
Sort of. So you said absolutely, but then you also said that you're looking to work with clinics or clinicians or providers. But my question is, well, we do deliver services to the community. We're not a clinic.
Right.
And one of our main focus, which we have been doing the last few years, is to increase the number of immunizations within the East African community, particularly the Somali population. But we have partnership with clinics that we work with. So my question is, can we directly apply for this RFP, or do we have to partner with a clinic in order to do that work?
So the answer is yes, as a community-based organization, you can apply for this RFP. The idea is that you would be coming, the selected candidate would be our partner, and that partner together, the two of us, would work with clinics. We would work to do outreach and engage clinics. So you don't have to be a healthcare practice in order to do this. But our target for the intervention will be healthcare practices. So we'll be working together. We're not a healthcare practice either on this team, but we'd be working together to work with healthcare practices to improve their rates.
Got it. Okay, that makes sense. Thank you so much.
And so I have a question here that says, will we be using data from the IIS system, or would we need to produce data? So we are, maybe I can have Sarah answer this question, but we are very aware of the data in IIS, so I think it depends on what you are planning on using that for. But I will turn that question over to Sarah, because she's going to be the better person to inform.
Hello, I'm not quite sure the context of your question. If you're thinking about for this grant application, you're welcome to use any data sources that you have access to that you feel like will show your organization's capacity to bring healthcare providers together to work on quality improvement. And then if you're thinking of the contracted organization after the grant has started being implemented, I think it might depend on the practice, whether you would be using their EMR or their IIS data. I could imagine that part of the quality improvement might involve them improving the quality of the data that they're sending into the IIS. Christiane, do you want to add anything about that?
So in terms of the data that will be, in terms of the data that we'll be using in the quality improvement activities themselves, well, so there'll be data that does come from benchmarks around what their current immunization rates are, right? And that would come from the IIS systems in general, or if they have better data about their whole picture, not just the VFC vaccine pieces, or however they feel it's best targeted, or in conjunction with what data that they have in their EMR. So yes, we'll be engaging that, but we will also be really looking at data that will be taken from evaluating the actual intervention. So the number of times that they tried to reduce missed opportunities by doing XYZ, those kinds, tracking that kind of data. It's going to be really around the activities. What are they trying to do when they do these plan, do, study, act cycles in trying to figuring out an intervention that works in terms of making an improvement in their system. So that's really going to be the bulk of the data. And then ultimately looking at whether or not it impacts over that 9-month period the immunization rates. So I have another question here that says, do oral health providers fit into a category of practitioners? They certainly fit into a category of practitioners. However, I don't think they're going to be they're not really, I don't know of many oral health providers who are routinely delivering vaccines to adolescents and teens. So they really aren't going to be the ideal target in terms of membership for this collaborative. We really want to be focusing on primary care, family practice, pediatric settings where they deliver care and particularly deliver vaccines to adolescents and teens. Any other questions? I don't know if anyone else is on the line. Keep in mind you can always email questions later up through September 6th. So if you don't think of any now, absolutely. If you want to watch the webinar again, review the RFP, you can send all your questions into that email address on page 1 of the RFP, and they will make sure that they get to me and we'll get you answers. So if there aren't any more questions, we can go ahead and wrap up early and folks can get back to their day. I want to thank everybody for your time and your interest. We're really excited about this project and we're hoping to get things going here soon, and we're looking forward to working with our new partner. Thanks.